Well, we know that vaccination is critical to ending the COVID-19 pandemic. We also know that some individuals are hesitant about being vaccinated because of the potential for side effects from these vaccines. So we wanted to know if, for some individuals, is it possible that psychological factors such as expectations or worry are exacerbating the experience of side effects from vaccinations? In April of 2021, we asked 551 individuals to report on the side effects they expected from the vaccination, as well as their level of worry and depressive symptoms. Then we went back to them 3 months later, post-vaccination, and asked them to report on the side effects they had from the COVID-19 vaccine. What we found is that individuals who expected more side effects reported more side effects. We also found that individuals who had more worry and depression prior to being vaccinated also reported more side effects. So we think this suggests that psychological factors such as expectations and worries might be creating sort of a self-fulfilling prophecy effect. It's enhancing or exacerbating the experience of side effects from the vaccine. So in my research, I'm really looking at how psychological factors like beliefs, expectations, our prior learning experiences shape the way we respond to medical treatments. Because we know that treatments have their own effect, but psychology adds another layer to this and it can shape how we respond to those treatments. There's a deep literature looking at this and showing that these psychological factors can shape the side effects from drugs and treatments and vaccines. But this is the first time it's been shown with COVID-19 vaccine. I think it's very critical for us to add to the public knowledge about COVID-19 and learn what we can to help people in this really stressful time of our lives. So I think to me it's really critical for psychologists and researchers to get engaged in this pandemic and try to do what we can to understand what's happening to people and how they're responding to the pandemic in general, to getting vaccinated, to increase vaccination status. I think we can play a pivotal role because we know that one of the key elements of the pandemic is health behaviors. Individuals behaving the way that we need them to reduce the spread of COVID-19 and to increase vaccination. We know that there's a lot the person can do on their own. And so we would like to see psychologists get engaged. So to me, it's very important, and I think Toledo has done a really good job of supporting that sort of research.